Welcome to Accessibilities, hosted by Dr. D and Marquis. Hi, I'm Dr. D. Giannetti, and this is my co-host and service dog, Marquis. High five, Marquis. High five. Yeah, high five. Marquis, say hi. Atta boy. And who's our special guest today? It is Arianna Faro. Okay, thank you, Marquis. Down. This show is a show celebrating the lives of people with disabilities. And as I've mentioned in previous episodes, there's a saying, if you see it, you can be it. But there is an extreme shortage of people with disabilities visible on the screen. So by highlighting people who happen to have a disability, I'm hoping to show people with interesting lives, interesting hobbies, interesting jobs, talents. And also, I'm hoping that a viewer watching may say, I have that disability, and if she or he can do that, maybe I can do that too. So today, we are going to be talking about hidden and invisible disabilities. Hidden disabilities are certain disabilities that are not immediately apparent to others. It's estimated that 10% of people in the United States have a medical condition which could be considered an invisible disability. According to the Americans with Disabilities Act, an individual with a disability is a person who has a physical or mental impairment that substantially limits one or more life activities, has a record of such impairment, or is regarded as having such an impairment. Hidden disabilities is a very wide umbrella, and it can include brain injuries, chronic pain, mental illness, chronic illnesses. Because they're not obvious to spot, invisible disabilities may be overlooked and misunderstood. This can lead to discrimination and exclusion of those with hidden disabilities. The list of hidden disabilities is long, but I'm going to name a few so that you can understand. Autism, fibromyalgia, PTSD, depression, multiple sclerosis, traumatic brain injury, epilepsy, diabetes, and renal failure. These illnesses must significantly impair normal activities of daily living. So today my special guest is Arianna Faro. She's our newest member to the commission. She's in her second year of college, majoring in psychology. She's a lifetime resident of Wilmington, and she has grown up with a rare hidden disability. So welcome, Ari. It's nice to have you here.
Thank you, Dr. D.
How are you today?
I'm very well, thank you.
So do you want to mention what your disability is?
Sure. So I was born with a condition called Klippel-Trenaunay syndrome, and that entails varicose veins, overgrowth of soft tissue and bones, and I always forget the last one. Oh, a port wine stain, which is just kind of a fancier way of saying birthmark.
A big birthmark.
Yeah.
Yeah. And so when did your parents find out that you had this?
My mom actually found out in utero. They found out about 6 months in. They didn't know for sure it was this particular disease. They just knew that it was going to be some kind of vascular anomaly. So when I was born, my dad said there was at least 20-something doctors in the room because they weren't sure, you know, if I was going to bleed out, if I was going to, they didn't know what was going to happen. So they were well prepared. And then
pretty scary for them.
Yeah, and they were in their 20s, you know, so I can't imagine. I'm 29, and I can't imagine grappling with something like that. But they did, and they did so really, you know, they did so really gracefully, and I give them a lot of credit.
So we're going to talk about your life, but you want to tell them a little bit about, I know you've had a lot of hospitalizations and a lot of surgeries, so you want to tell them how this disability has affected your life?
Yeah, this disability has impacted my life momentously. I've had over 138 hospitalizations.
Wow.
And it really has bled into every aspect of my life. I used to, when I was younger, I used to try to keep things separate. I used to be like, all right, so I have my medical life and I have like the rest of my life, you know? And what I didn't realize is that the two are inevitably going to be entwined.
Right.
So it was kind of hard for me to come to terms with that. But
and I know you've had a lot of surgeries.
yeah, over 50.
Wow.
Yeah.
Wow. That's overwhelming for anyone, but especially starting in childhood.
Yeah.
So what was it like for you growing up?
Growing up, well, my parents, I have two sisters. I have an older sister who is 3 years older than myself, and I have a younger sister who is 6 years younger than myself. But my parents raised me just like my sisters. I was expected to abide by rules, expected to go to school and get good grades. And, you know, of course, when I would have a surgery or an infection, which are symptoms of the Klippel-Trenaunay syndrome, of course, you know, then my life was a little different from my sisters. But overall, I had a very normal childhood. Yeah. In spite of the surgeries, in spite of the infections.
Yeah. So were there some things that you couldn't do in school
Yes.
as you started school?
Yes. There's one day in particular that stands out to me, and that was field day, which I don't know if everyone knows what that is.
You can say.
It's just a day where, you know, the staff sets up like really fun games for everyone to be involved with. And anyway, I was in 5th grade, and I was required to wear a bathing suit. And as I mentioned just a little bit earlier in the chat, I have a port wine stain, so I have a big birthmark, and my...
And where is it?
On my left leg.
Yeah. And
my left leg is 3 times the size of my right leg, about, roughly. And when, you know, when field day came, I said to my mom, I'm like, no, I'm going to wear my bathing suit. I'm going to be like everyone else. And boy, did I not know what I was in for. I got made fun of so much for it. People were coming up to me for weeks after, like, what happened to your leg, you know, and they would make fun of it. So I got called a lot of names and whatnot.
Yeah. Oh boy, that was difficult. And and some of the other things that we've talked about before. Were you able to participate in gym class and activities like that?
In elementary school, I was able to participate because Klippel-Trenaunay syndrome is progressive. So when I was a child, it wasn't as bad as it is now. And by that, I mean I didn't have chronic pain back then. Also, I didn't grapple with like as much bleeding, blood clots, cellulitis infections, sepsis. I didn't have those as much as I do now.
Right, right.
Yeah.
So, so I think when we were talking, you had mentioned that you weren't able to participate in gym class.
Yeah, middle school.
And so, did anybody speak with your peers to let them know that you have this disability and this is why you can't participate?
Nobody ever did that. In fact, in high school, I was absent so much because I was getting cellulitis and sepsis roughly 15 times a year. Wow. So I want to maintain as normal as a life as possible. So I still want to go to school, regular school, like my friends were doing. You know, I wanted to do what my friends were doing. Right. And I was absent about 130 something days of the year. So that was you know, a tremendous period of time to be absent. And what I would do is I would come home from the hospital with a PICC line in. And a PICC line, should I say what a PICC line is? A PICC line is basically just a more permanent form of an IV. It's when you're going to be on medicines for a long period of time. And instead of giving them to you in the hospital, they can send you home with them. So I would go to school with my PICC line in and go down to the nurse and get my medicine. And I was, how do I say this, viciously bullied. I was called the girl who has AIDS. I was called the girl who was pregnant and got sent away somewhere. I was called the girl who makes up excuses to be absent. I mean, really just anything you can think of.
That must have been really difficult. That's the challenge for many people with a hidden disability, is feeling misunderstood or ignored or feeling invalidated.
Yep.
Some people with hidden disabilities are accused of faking or imagining their disabilities. And being overlooked or misunderstood can lead to discrimination and exclusion. You know, it's wonderful that your parents instilled with you that you are a normal child, just like everybody else, and your aspirations were always just to be a normal child. I really admire that about you, Ariana.
Thank you. Thank you.
Yeah. But it's difficult when you have that type of bullying. So I have a hidden disability too. I have a visual impairment.
Okay.
I'm legally blind, and my son, when he was in grammar school, was having a problem with his peers understanding that he had a mother with legal blindness. What's that like? And they were thinking that he doesn't have a mother that can be a mother. And this was also the Wilmington school system, and for him, he was lucky. I was invited to his class, and several of his classes came in, and all of the teachers, and so I talked about what it was like to be legally blind as a parent and as a person, and he got to talk about what it was like to be the son. You know, what's it like to have a mom?
That must have been a really phenomenal experience. I wish I had been given that opportunity, and if I could go back in time, I would say to my guidance counselor, can we do something like along those lines? Because there was just so many rumors going around, and they were all incorrect, and it hurt my feelings.
Yeah, it makes it hard to deal with things like that. So,
yeah.
So I think the schools are getting better. And trying to be inclusive of everybody, no matter what ability or disability a person has, and what ethnicity, nationality, the whole thing. But we still have a long way to go, and that's why this show is so important.
I'm so glad we're doing this.
Yeah, so other people can see how brave you are
Thank you.
to go through that, and other people suffering with hidden disabilities who are in school age can see that there is something that can be done to help normalize their disability. This happens to be a medical issue, and this is how we take care of it, and this is what I have to do in order to perform the regular activities that everybody else performs.
Yep.
Yeah, that's great. So when you were 16, I know things kind of came to a head for you. What happened then?
When I was 16, I was really sick. I had doctors saying, well, why don't you just cut off the leg? You know, it was a very tumultuous time for me in terms of my physical health. Should I go into the reason why?
Sure.
So my clipple impacts my left leg. I don't know if I should say it's private areas, and my heart and my lungs. So even if the problem with clipple is, if you were to cut off the leg, the stump would never heal normally. And my doctors said, my primary doctors, they said you would never heal normally and you would be in the hospital even more than you are now. And they still stand by that. At 29, I'm 29 now, and they still stand by that, you know, that cutting off the leg is not my answer. But, you know, I think all that stress manifested itself in me. And what ended up happening is I started to feel overwhelming anxiety and depression, and OCD, which I was later diagnosed with. But I was, you know, doing things in threes, and they had to be meticulous, and it was hard because I had, up until that point, I was a very happy, well-adjusted person despite my disability. And, you know, I would say now to someone, I'd be like, well, you know, look at all you've been through. Of course, it's kind of normal that you're going to have a little bit of sadness and a little bit of anxiety, but this was to a whole other level.
Yeah. So OCD is obsessive compulsive disorder, and it is manageable, but it can be with medications, it can be without medications, and a lot of cognitive behavioral therapy.
Do you want me to speak on that a little bit?
Sure.
I've been in cognitive behavioral therapy since I was 18, so 11 years now. And I also am on medication for it. However, I'm not advocating that anyone goes down that route. You know, I'm not saying that's what people should do. I think you got to find what, you know, a treatment plan that's tailored to the person specifically.
Right. And it's nice to know that medications help some people.
Yeah.
And some people don't need medications.
Yeah, for me it's a combination. I need cognitive behavioral therapy still, but I also need the medication. Yeah.
Right. Very good. Very good. So then one of the things that you had told me previously was that the mental part of your disability it is proving to be much more difficult than the physical part.
For me it is, and people look at me so strangely when I say that. 9 times out of 10 I get like really strange looks, because they're like, you've been hospitalized over 130 times and that you're saying is more painful than, you know, the physical aspect. And I'm like, yes, actually it is, because you know, when you go into the hospital and you're really sick, I've had plenty of times where I've gone into the hospital and I've had 105 temperature, and it was just really scary. But it's up to the doctors to find the right combination of medicines to treat you. And I'm not saying it's not like that in psychiatry, it is, but you also in psychologically speaking, you have to put in a lot of that work. No one can go into your mind for you and plant a magic seed. You know, you really have to do so much of the groundwork. If you don't do your cognitive behavioral therapy, you know,
you're an equal participant with your therapist.
Yes, yes. That's a great way of saying it. Yes.
Yeah. That's great. And so, you know, that's what's helpful. That's what can work. Some people, you know, feel like, well, it's shameful to go to a therapist and to do that type of work. I felt that way
for many years, to be honest.
Yeah.
Sorry to interrupt.
No, go ahead.
When I was 16, I had so much pride. I was like, I don't need therapy, you know, and I'm going to continue to be that well-adjusted patient that everyone calls me, you know, that well-adjusted patient. And I had so much pride, and I carried that with me for 2 years. And my freshman year of college, when I was 18, I had a major mental breakdown. It was Christmas Eve. We were at my aunt's house, and for some reason, that night everything just came to a head. I think because I think the reason it happened on Christmas Eve was because it's a time where you're expected to be happy and, you know, joyful and grateful. And I was just feeling so miserable inside. And
you were carrying a very heavy burden.
Yeah, and I was just watching my family have so much fun. We're a close-knit family, so my family means everything to me. But I was watching them have so much fun and being so grateful, and I felt so different. I was like, oh my God, I'm really sick. So I asked my sister to drive me home. I just said I wasn't feeling well, and she did. And then so I crawled into my bed and I lost it. I started crying uncontrollably for several hours straight. Luckily, my mom came home a few hours later, because she just thought like I had a stomach, you know, like a stomach issue or something.
Yeah.
She didn't know, so she came home several hours later, found me in my bed, and found me crying uncontrollably. And I was unable to even get out of bed for several days after that. So it
really,
was very hard.
Really took a toll on you.
Yeah.
Right. And I suppose you had a lot of negative feelings associated with all of that.
Mm-hmm.
Right. So then your parents took you to...
Yeah, so there was a therapist on campus, and my mom called her, and I credit her with really helping to save my life. As far as the psychological stuff goes, her name was Sharon. She swept right in, and she literally helped save me, but she gave me an ultimatum at one point. She said, you either have to go on medication or you have to go be admitted to a psych unit. So I was like, okay, give me the medication, you know. So, but she was amazing, and I felt I could really open up with her. She's retired now, but at that point in my life, I really needed her, and she was there for me. And that goes for my parents and my sisters too. They were all so welcome. Not welcome, that's not the word. They were also...
Yeah, how has your disability impacted your family?
Well, being hospitalized 15 times a year, my mom doesn't like to leave me. She likes to be there at all times, so she knows like what's going on medically and just making sure I'm okay, because there have been incidents in the past where like I almost bled out to death one time after a surgery, and my mom caught that at 4 a.m.
Wow.
She saw that my drain kept like filling, and she called the nurse, and I had to have emergency surgery at like, I think it was 4 a.m, and the doctor had to rush in, and it was a whole thing. But my mom like will not leave my side. Right. So she misses a lot of work. And my dad, he misses a lot of work because of it. Well, how do I say this? As the head of household, you know, he has to go to work.
Right.
But he'll come up after work and visit me every day.
So you have a very supportive family unit.
He will literally come visit me every day after working like 15 hours, and he'll be there.
Yeah. Wow, that's wonderful.
Yeah.
That's terrific.
Yeah, I'm very lucky.
Yeah. So, so you're in school, and you're majoring in psychology.
I am.
And what would you like to do with your degree?
So I want to become an OCD specialist. I feel having gone through it, it does give me a perspective lens to work through, and I just think I could help a lot of people, and I'm really passionate about it.
That's terrific. That's really wonderful, Ari. Well, thank you very much.
You're welcome.
This has been really great.
You're welcome.
So I just want to talk about a few more things. People who have never interacted with a person with a disability, or a physical or a mental disability, may think it will be intimidating or nerve-wracking and worry about what to talk about. It's important to realize people with disabilities should be treated the same as everyone else. The most important part of interacting with a person with a disability is to see the person for who they are, a person, not as whatever disability they have. So I have a few points on disability etiquette. And the first one is find commonalities before thinking about differences. Common ground is the base of all human connection. Make eye contact and do not avoid the person with a disability. People who are afraid they may say or do something unintentionally disrespectful will sometimes default to ignoring the person altogether. This can lead the person with a disability to feel their existence doesn't deserve acknowledgement. Any human would feel terrible if being ignored. Speak to the person with the disability and not their caregiver or the person who is with them. Always speak to the person with the disability first. It's the respectful thing to do. Talking to the person with them first shows that you see the person as talking to the person with them first shows that you see the disabled person as unequal or incapable. Ask a person with a disability if they need help before trying to provide it. You can ask, is there something I can help you with? Or, do you want me to get the door for you? Helping before asking implies that the person with a disability is incapable and can be offensive, particularly if the person with the disability has worked hard to be able to care for themselves. Do not underestimate the abilities of people with disabilities. Many people with disabilities are capable of caring for themselves without any assistance. They know what they are capable of and what their limitations are. Do not assume people with disabilities see their lives as tragedies. We're not poor people. Many people with disabilities have worked hard through tough emotions to be content and happy with their lives. Do not victimize people with disabilities. Referring to people with disabilities as victims takes away the person's power. It takes away from their ability and strength to overcome, putting the emphasis instead onto what has happened to them rather than what they have done about it. Survivor is a more appropriate term. But the most important thing to learn and remember is to treat people with disabilities the way you would want to be treated yourself. We all want to be treated with respect. So today's inspirational notable quotable is by William James, an American philosopher and psychologist. The greatest discovery of the 20th century is that our attitude of mind determines our quality of life, not our circumstances. So with that, I want to let you know, if you or someone you know is a disabled person who is interesting or has an interesting job, hobby, or talent, we'd love to hear from you. We'd love to have you as a guest on our show. You can email us at accessibilities2020@gmail.com. You can also reach us, we are on YouTube under the word Accessibilities, all one word, and click on the icon with the Statue of Liberty seated in a wheelchair. There is a discussion board there. If you have comments you'd like to make about this show or have questions that you would like answered, we'd love to hear from you. Okay, so stay positive. Marquis, up. And we'll see you next time. Marquis, say bye.